the masterclass webinar series. Wow, what an amazing idea spearheaded by Springfield Theater Center. And just do us a real quick favor. If you guys are on right now, just mute your microphones for the time being so that you don't pop up on everybody's screen, and so that we can kind of have a decent flow. I'm starting to see some microphones on and it's kind of causing some feedback a little bit. But again, I'm Justin Carter. This is a very low key, it's a very informal type of webinar series that we're going to do today. But it's very, very important that we do this because we're all itching to get back into theater and to just get back into the everyday grind of magic that we all create, whether we're watching it in the audience or whether we are on stage performing. So I will be the moderator for today. And before we begin, though, I was given a list of things that we have to go through. We have to lay down some ground rules before we get started, of course. So bear with us, okay? And so, again, my name is Justin Carter. This is a space of mutual respect, based on mutual respect. Although we may not always understand each other in this space, the best thing we can always do is to honor ourselves and each other by holding space and regard for one another. This means that there will be no harassment of any kind. Obviously, everybody is welcome here. We ask you that you consider yielding speaking time for those who may not have gone yet or have the opportunity to use their voice. Again, we thank you much in advance for all of this. And please go ahead again and mute yourself if you have not done so already. Let me tell you where the mute button is. It should be on the bottom of your screen and to the left. And we want you to also familiarize yourself with the raise hand feature. It's located under the tab that says participants. And when it is time for questions, we will get to those questions after a few things. You'll be able to use the raise hand feature to signal your question, or if you would rather, you can also ask your questions in the chat. And we'll be monitoring the chat as well. We have Tammy Kuhn-Schnell. She is from STC. She'll be monitoring that as well, and just kind of making things easier. Tammy is known for making things easier. If you know her, you know. All of our masterclass sessions will be closed captioned too. And if you'd like to turn this feature on or off, you can click the CC icon. It's at the bottom of your Zoom panel. You can also adjust the size of the captions by locating the Zoom software setting, and you can click the accessibility tab. And then additionally, after the webinar is concluded too, we would also appreciate you filling out a really quick survey, giving us some feedback on how we can maybe do things better, or if we're doing things fantastically, perfectly, that's great too. We love that feedback. And then the link will be posted in the chat box as well. So look out for that in the chat box. And of course, we have to remind you, this meeting will be recorded for people in the future who can't make it tonight. So now that we said all of that, we have gotten all of that out of the way. We again, thank you so much for being here today. We have people from New York. New York's in the house, upstate New York. So that's so exciting. We welcome you. And of course, we're in Springfield here. So it's just awesome to see people out, even in the East Coast, joining us to, just get the word out there about theater in a COVID-19 world, in the COVID-19 space, and how we can move forward. Okay, let's introduce our speakers today. Let's not call them heroes, they're sheroes. You probably see them on the news every single day. Vidya Sundarashan, she is a doctor, medical doctor at SIU. She's a professor of clinical internal medicine in the Department of Internal Medicine. She's a program director, infectious disease fellowship program of the Infectious Diseases Fellowship Program. She's also the interim chief from the Divisions of Infectious Diseases, and she's a fellow of the Infectious Diseases Society of America, fellow of American College of Physicians, Health Grades Recognized Physician, multiple recognitions from the SIU staff, her whole family involved in STC shows as well. So Dr. Sundarashan, thank you so much for being here today. We were just talking before this, you and our next moderator, our next participant, Gail O'Neal, you guys really are spearheading, this fight against COVID-19 in Central Illinois, and we can't thank you enough. And so speaking of which, we have Gail O'Neal here, somebody we talk to every day on the news as well. She's the director of the Sangamon County Department of Public Health. She has 38 plus years of combined experience with both the former City of Springfield Health Department and the current County Department, which is now serving city residents as well. She has a degree in health sciences from Western Illinois University and started her career as a health educator. And she was an assistant director of the county department starting in 2006. Also, the health department, it provides services on a contract level to Menard County. 96 employees under Gail O'Neal, and she manages a budget of $9 million. So Gail and Dr. Sundarashan, they are amazing people. They have been answering questions for the past year and now some change. So we thank them so much for being here. And so they're going to take things over. They're able to share their screens for us, and they're going to have a quick presentation for us in regards to COVID-19 and as it relates to theater. And then after that, we're going to open it up for some questions and really get our feet wet with how can we survive moving forward. It's something that we all want to get back to. So without further ado, either Gail or Dr. Sundarashan, you can take it away. I don't know who's first, but take it away. I think there you go. You unmute yourself. Perfect.
First of all, thank you, Justin, for that fantastic introduction. And thank you, Tammy, Jen, Justin, thank you for having us here. On my part, I can tell you the theater community is something that I admire a lot, something that I really look forward to. Seeing back on stage, and also myself personally, I am invested quite a lot in theater. So again, thank you for inviting us, and thank you for having me come and talk here. Really, this community just makes my soul happy. So with that, today we're going to try to keep this as informal as possible. I just have about 10 or 12 slides that I want to share with some important information in terms of where we are with COVID, and then what is already available. There's not much in terms of fine arts and theater from IDPH or Illinois Department of Public Health yet. But, there has been some from Restore Illinois, or some reopening guidelines that were previously there. And if some have changed or not, I'll briefly touch upon those. So you all have been seeing these numbers, and just a reminder again, this has taken a huge toll on us in more ways than one. Globally, 115 million, 2.56 million deaths. And here in Illinois, 1.2 million cases and about 22,902 deaths. So that's still a lot, taking a lot of toll. Even in people that recover, we see a lot of people come up with long hauler symptoms. So people can have just fatigue, weakness, have some headaches, brain fog, sleep disturbances in quite a few people that end up getting COVID. So it's still a big problem. Locally, what are we seeing? As of March 4th, our total positives were 16,217. This is from Gail's report every day. It is posted on the website. It gets updated every day. We talk about the new number of positives, people that are hospitalized, and Gail's report is on the website, which really shows us what's happening on a daily basis. And I think, Gail, you had your report today as well. There were about 20 new positives. Is that what you had reported today as well? Okay, so yeah, that gets updated on a daily basis. We also look at this number, a percentage positivity. We all keep talking about community transmission. What exactly does this community transmission mean? We look at the percentage positivity of the people that are being tested. How many actually come up with a positive test for COVID? So the daily positivity rate of when it was 5, when it was 7, when it was 10, we actually went up to 17 in our county. So that high. And it's so good to see those numbers come down. Less than 2.5 is good. You want to keep it as low as possible, but we're getting there. Our numbers are really looking good. So region 3, that's where Sangamon County really falls. Our 7-day rolling average was 2%, with a 2.3% daily positivity, and our county in particular 2.1%. So it's looking really good. The other thing we really track with COVID is also how many people are getting admitted to the hospital. So the biggest problem, as you know, with COVID has really been that you don't want to overwhelm the healthcare system. So you want to look at how many beds are really available. And that too, we're kind of doing pretty well on that as well. So 44 beds out of 163 total beds, and ventilators, we have quite a lot available too. So on both those fronts, our numbers look good. So our community transmission is not bad at this point. This graph says it all. Pictures worth 1,000 words, and this graph actually shows you where we were right after Thanksgiving, and then how we've kind of come down. And at this point here is when we started vaccinating. About the 17th of December is when it was first available, and we gave our first shots here in Springfield. And you can see the numbers have kind of come down more so. How much of this is from the vaccination? It's hard to tell, but definitely plays a big role. But we have to continue to do what we do in terms of our mitigation to keep those numbers that way. I want to add a time point, which is March 31st. We were expecting a surge in March because we saw that in the southern states. We saw that in other parts of the country. Typically in the Midwest, we lag that surge by about 6 weeks or so. So we were expecting that, but it hasn't happened, knock on wood, it hasn't happened till now. But we're going to watch very, very carefully till the end of the month. So that's really a time point that we're kind of looking at to see what happens, and that too with vaccination efforts that are really, really going well. And Gail probably talk about the vaccination efforts a little bit more too. You've all seen this, Restore Illinois, and a question always comes up. Oh, we're in phase 4. All of Illinois is now in phase 4. Everybody wants to know, hey, when are we actually going to phase 5? Not yet. We want to see our numbers low, and we want to be there for some time before we actually move to phase 5 and open up our economy completely. And that's the definition there, which the slide kind of talks about. So here with phase 4, we are still having gatherings. That number 50 is really what we are sticking to for most businesses, for any of the events, even with the schools reopening. That number 50 really is what as of now in phase 4 is being followed with most of the guidelines. Almost all the guidelines that are coming out are still sticking to that number. So here, what do we talk about when we are in phase 4? We still continue to wear masks, 6 feet distance between different households. This is specifically from theater guidelines that they were talking about. So staggered entries, waiting in lines, minimized, limit congregation, clean and disinfect. The cleaning and disinfection between uses is very, very important. And auditorium operation time less than 50 members or 50% capacity. So this was something that was in the Restore Illinois, which talks about different guidelines for different settings as well. And again, they have recommendations for theater in particular. If you look at the website, I've listed that on the subsequent slides, and it's available on IDPH's website. It talks about continuing health monitoring, the temperature checks, isolation of somebody that comes with COVID-like symptoms, continuing with deep cleaning, quarantining anybody that is a contact, and then displaying the signs of face covering and distance, watching the distance. Those are all still the recommendations. Regarding masks, I know 2 states have lifted their mask mandates, but we continue, and that's good. We need to continue at this time. 2 layers or more. If you're wearing a cloth mask, these need to snugly fit. So if they're not tight enough, they're even recommending double masking now, or using chin diapers or something that actually allows the mask to fit properly. So that's still a good recommendation. Questions come up about face shields. Are they good enough? CDC is actually studying that to see if face shields alone are good. But as of now, they're not a recommendation, because if you wear a face shield, you still have this area on the side of your face which is still open. So the droplets and aerosols can still escape through that. So face shields are really not a good idea still, and gaiters should be avoided as well. All right, so CDC, when asked about the size and about music and choir, their recommendations are, if you're going to do this, have small groups, cohorts, 5 to 10 students or people rehearsing at one time. You want to keep the same groups. This is really what is still available regarding music and choir from CDC. There's not much updated information when I last looked at this. And then IDPH has these 3 guidances. I put these up. The music guidance, which was really well written in terms of what to do when you have children playing instruments, written mainly for schools, but applicable everywhere. It's really nice in terms of sharing instruments, or what should you do, what not to do. And sports guidance, a lot of the dancing and a lot of the cheerleading is kind of explained there. So those might be some parallels that we could draw for the theater guidance. Still, the official guidance is available from IDPH. I know it's coming, but I don't have a time, but that should be available soon. But till then, these are some parallels that we can start thinking about while planning. And then the Restore Illinois kind of has these posters and other information for theater, particularly in addition to other businesses, which may be useful. All right, so I've included this from the sports guidance, which talks about cheerleading, which talks about dancing. Again, we're still pretty cautious. You want to really avoid shouting, singing, chanting too much without a mask. Definitely not, because you're expelling a lot more droplets with activities like that. So, and they do give specific recommendations for cheerleading and for dancing as well. Most important thing is to try to maintain distance as much as possible with these. There are some encouraged best practices with sports organizers. I thought these were really well written in terms of when you're traveling, try to limit contact in the car. How do you do that? Travel with groups that you're familiar with, groups that you hang out with, and then what to do in terms of keeping oneself safe. And then again, from the sports guidance, this might again be relevant when we are talking about having things in a closed auditorium, having activities in a closed auditorium, having performances in closed auditorium. The distance that's recommended between the performers and the spectators is about 30 feet. It's not possible in all situations to have the 30 feet. So they said between the performers and the spectators, at least 12 feet of distance. So that may be something that, relevant parallels could be drawn from that. But again, these guidelines will be more concrete, will be available from IDPH as well. And again, there have been questions which come up in terms of outdoor camps. What do you do? What is it safe? Outdoor activities are always safer as compared to indoor activities. Is there a limit to the total number? Is still say about 20% of capacity for phase 4, but you'd still want to try to minimize the numbers as long as you can maintain the 6 feet distance. That's really the biggest thing. If you're having people get together for eating and things like that, you need to particularly be very careful, because that's the time when they're not wearing their masks. So I want to end with this. Hope is on its way. We're really, happy that we have all 3 types of vaccines available in our county. And if you look at the percentage that have been vaccinated, our county is actually doing really well, really well. Gail, correct me if I'm wrong. I think we have about 15 to 17% of our county that's gotten their second shots already. So fully immunized.
Right.
2 weeks after your second shot, you're considered fully immunized. So we're really doing well in terms of vaccination as well. I'll stop there. Gail, do you want to add a few comments about vaccination, and then I think we can take questions.
Okay, thank you, Vidya. Vidya and I like to do this together, so I appreciate her inviting me to join her and you on this event. It's very nice. I appreciate it. So vaccinations have been our main focus since they've come into our community, starting with Moderna vaccine. That's a 2-dose vaccine. We've been doing that since the first part of January, and have vaccinated a lot of people. As Vidya said, 15% of our eligible population has been fully immunized already. We've actually vaccinated 70,000 people altogether. And so the additional 23, almost 24,000 are second dosed already. The first people vaccinated were the healthcare workers and the people in the hospitals, because we had a lot of people in the hospital, a lot of people exposed continually. So that was our first goal there. The community is doing really well. We were afraid of a lot of vaccine hesitancy, and we still see some of that and want to talk to people and see what their concerns may be. And doing these kind of presentations and answering questions, I think, helps a lot. So we're happy to do that. 3 weeks ago, almost 3 weeks ago, we got to have the National Guard join us in Sangamon County out at the fairgrounds to put a big team together to try to get a lot of vaccine in the region. About 60% of the people who are making appointments for the National Guard Fairgrounds event or opportunity for vaccination are from Sangamon County, and the rest are from all over the state. There's people, at least about 800 people with appointments from Chicago to come down here for vaccinations. It's big, it's very efficiently run, and we appreciate that. That comes with a lot of vaccine as well. So we encourage people to make appointments and then be vaccinated. So we're happy with that. They sent us some mobile teams to go into some community groups. Yeah, vaccine it's exciting because it's really a great tool. We've worked to try to make sure that our community slowly opened up and that we could keep it open as we went, and want to continue to see that grow. So I think I'd rather answer questions as we go along and see what else I can provide for you.
Thank you, Gail, and thank you, Doc, as well for that. I mean, just information is coming in every single day, updated information, and you guys update those slides and are all about education. So we really, really appreciate it. So at this time, let's just jump right in. Of course, you can just use that hand wave, and then we'll try to select you. And yeah, we would love for you guys to ask your questions personally, so I don't have to do it. Because we want to see your face. You don't want to see my face. I do this for 3 hours in the morning every morning. You don't want to see my face anymore. I want to see your face. So do we have anybody who wants to join us and ask a question? While we get that situated, you know what? I'll start. How about that? I have a question for both of you about the Johnson & Johnson vaccine. It's a one-shot vaccine. I feel like it's going to be gaining a lot of popularity because you don't have to go twice, but also the efficacy seems like it is a little bit lower than the others. And so as far as the Johnson & Johnson vaccine goes, should we be concerned of that efficacy rate in the fight against this virus? Will people be more prone to COVID-19 if they get the Johnson & Johnson versus the other ones, the Pfizer and Moderna's?
Gail, do you want me to go first?
Yes, why don't you go first, Vidya?
All right. So, I'm going to start with a quote from a vaccinologist who says, the best vaccine is the vaccine that's available to you at this time. So, the numbers that we're talking about, the efficacy, the difference, how much is it really, what does it mean? So for Moderna and Pfizer, they say that when they studied the vaccines, the efficacy was 94 or 95%. Pfizer, now we have some real world data as well, and they say it's about 93% efficacious, which is great. For J&J, the Johnson & Johnson vaccine, it's about 72% efficacious here in the United States. So they studied it in multiple countries. In South Africa, with the strains and different types of COVID variants circulating, their efficacy was about 59 to 61%. In Latin America, it was about 66%. The good thing about this J&J vaccine is it was 100% effective in preventing death, any type of COVID death. So 0 deaths in the vaccine arm, which was great. And then also for severe disease, by severe disease, we mean people that are admitted to the ICU or have respiratory failure, have other organ failure. It was about 85% efficacious in doing that. So it's a great vaccine. The advantages that it really has is just the one shot. So great, wonderful. And it, even for people that are giving the vaccine, they don't have to store it in an ultra cold storage chain. And even when you're administering it, you don't have to use those special diluents to give that. So there's so many advantages with that vaccine. At this point, we want to really try to get as many people vaccinated as possible. We want to get to that herd immunity level as fast as possible. And that's really one of the things we can do to succeed. So I would say that take whatever vaccine is available. And J&J, although the numbers look like it's less efficacious in really things that matter, severe disease and prevention of death, they were really good.
Right. And we've just gotten our first shipment today of the Johnson & Johnson vaccine. We have had the Pfizer, which has to be diluted and kept 80,000 degrees below zero. That's not correct, but it has to stay very cold, and it has all kind of particular things to make sure that the vaccine is at the right temperatures and kept carefully. The Moderna is about the same way. It's a little bit easier to handle, but the Johnson & Johnson is really easy to administer and take out into the community. And when the state sends us, we just have the vaccine that gets sent to us. It's really, we don't have a choice often. So with the two original, the Pfizer and the Moderna, you have either a 3-week or a 4-week wait time for the second dose. So it's really a challenge to try to figure out how many first dose appointments you can have at the same time you're having the second dose. And if you had a bad week, like we were really busy at the fairgrounds and ran out of Pfizer, which was our 3-week cycle, we had a plan, and then we had to do 4 days of Moderna. So that makes it's just confusing, which also helps with thinking now that we do have some Johnson & Johnson vaccine. So we're going to plan to get that out as much as possible. And some of us had already got 2 doses thinking, darn, if we waited a little longer, we could have had the 1 dose. So we're looking forward to that, and we'll take any vaccine we can get. And as Dr. Sundaresan said, it's, a vaccine is good. And if you can get it, that's our goal for everyone.
Perfect. Thank you guys for that. Clear that right up for me. All right, let me try to bring some people in. I don't know if I have the power to do that. I see Mary has her hand raised. Mary Donathan.
Yeah, it's not really Mary. It's Greg, her dad.
Oh.
But I don't have the technological savvy to change that name, and it's her iPad. So with that, I just was curious. So I saw that it said 50% capacity on one slide, but then 20% later as well. So I just wanted some clarification on that. But more specifically, if we were doing a show in a gymnasium at a school, what kind of capacity can we have in that? What are the standards around that situation?
Well, the situation is it's written now, and one of the things is they're supposed to be watching this and adjusting it as our positivity rates and everything else go down. The indoor performance is 50%, 50 guests, or 50% of the overall performance space, whichever is less. So even if you have a giant place inside, you're still to only have 50 people. And then encourage the 6-foot distancing from anyone who's not in the same household. The outdoor theaters, which I think is a little interesting because you've got all this open air and it's a 20% occupancy in area. So I think that those things are, we've got, sports talking about football. I got a whole football stadium and I can only put 20% occupancy in there. It doesn't seem to have the same risks. So I think those are things that will be adjusted soon with everything going on. But yeah, so 50 people inside or 50% occupancy, whichever's less.
Thank you.
You're welcome.
Perfect. Thank you, Greg. All right, we have Gus Gordon, who is the executive director of the Hoagland Center for the Arts. He makes a lot of decisions, and obviously I've seen it firsthand. He's been following this very closely because he has a lot of people's health in his hands because he's making decisions for theater. So Gus, can you hear me?
I can. Thank you, Justin.
Yes.
A couple of different questions, if you don't mind. First of all, thanks to STC for organizing this. It's a great event, and we're all going to benefit from the information we get tonight. So thank you for that. 50 people inside. What does that mean? 50 audience members, 50 people with the cast, the staff, the support personnel, and the audience? There's been a lot of confusion about that. So that's my first question I'll leave out there.
Gail, do you want to answer that? I can tell you what they are doing with sports. They've restricted that to about 50 spectators. So it usually goes to about 70 or 75 with the performers, et cetera, et cetera. But you have to be mindful of the distance that's there between the spectators and the performance. And again, these are the sports guidelines as of now. But again, there have been discussions also that that might be too much. 50 should include the performers as well. But for now, it's the 50 is for the spectators.
That's correct.
The other question I had, a lot of the guidance seems to be for audience members. We don't really hear a lot about performers, people who are acting loudly, people who are singing. Do they have to be masked? How close can they be together? How practical is it to do an actual show under those circumstances? So we don't see a lot of guidance, and I've scanned just about everything I could find. That we don't have a lot out there that tells us about the actual performing. So I'm interested in your thoughts on that. Thank you.
Go ahead, Vidya.
So great question. Actually, I was trying to see if there was anything available. I didn't see it, and I'm really looking forward myself to the IDPH guidelines to see what they are going to recommend. But I was listening the other day to a theater performer in Israel. Where their vaccination rates have been very high, and they have people that are vaccinated showing their cards to enter gymnasiums, etc. And they were talking about putting on a show in theater. The theater performers were masked. So the director was asked questions about how did people really enjoy the show with the performers being masked. The emotions really are not seen a lot of times with masking, and emotions and show of an expression is so important for theater. So it was supposed to be a comedy, and he said it was actually pretty well received. So the performers were masked, and as people get vaccinated, I think that would be another thing to consider. The people that are coming to a theater as audience, if they are vaccinated, that also makes a lot of difference. But I think we will probably have some masking recommendations. Again, this is a speculation for the performers, at least for now.
Yeah, and we had talked about, and with bars and restaurants reopening and having live music and keeping some distance from the audience. And then everything else is recommendations. They haven't banned that totally, but it seems that, and I was thinking about the performing arts that you are doing, the people that seem most at risk to me are the ones that have to practice and spend so much time preparing in comparison to the audience that would come. I mean, you're spending a lot of time in close quarters, I would imagine, working on the performance. and singing and practicing. And so the risk of, who's most at risk seems to me to be the performers as they prepare to do the presentations. So it's kind of just everybody working on the risk. And as you do this and prepare, you kind of will think about all these risks and maybe, distance a little bit farther than you would have before. All 100% risk is not going to be gone. I mean, everything has a little bit of risk, but you can manage that a little bit more. So I would think the performers are at a little higher risk than the audience at this point.
One advantage may be when they're spending this time together, they constitute a pod. If it's 5 to 10 people, they're pretty much the same group and bubble, as long as they don't have active social lives or other things where they could pick up infections. But if they're spending a lot of time together at work, that could be considered a bubble too.
Perfect, guys. Thank you so much. Let's move on to the next question. There are some people that are in the chat right now waiting for their questions to be answered. Jacob Dieters, I believe, asked the first question. He says, I don't know much about what has been communicated about a transition into phase 5, but what do you see some best practices when dealing with audience sizes? I know Gus kind of mentioned that, and that was one of his big questions. And Jacob says he can't imagine us jumping from just only 50 people to full houses. So is there a timeline or maybe something in the foreseeable future you can kind of gauge as far as audience sizes go?
I really don't know, because if you do look at phase 4 and then 5, you go from this tight small group to everything's open, and that is scary. And that's something that we've worked really hard to get in as good a shape as we are now. So it seems that a gradual reopening even to theater would be a wiser, but I think people are going to get excited. And if this happens at the same time with our numbers going down and a higher vaccination rate, yeah, I can't imagine either going from 20% or 50% to a full house, but I hope we see that the next year.
Yeah. Okay, thank you for that, Gail. Let's move on to the next question in the chat. I have to open it. Give me a second, sorry, thank you. Okay, Vanessa Ferguson is right under Gus. She's the assistant director for the Hoagland Center for the Arts. She says, what are some things that could prevent us from reaching herd immunity as a community? Also as a theater community too, we play a big part in that. I mean, even hosting big gatherings could be a recipe for disaster, a super spreader event. So what are some of the things that could prevent us from getting there?
I think I would say the biggest challenge that we are coming across is vaccine hesitancy. There's still a lot of people that have questions or concerns or fears about the vaccine. So Gail can probably talk more to this effort, but from SIU, I know there's a lot of efforts with regards to education, and we talk about the safety of the vaccine, etc. So that's definitely been helpful. And again, Justin, like you said, we really want to be as mindful as possible to stick to the 3 W's and then the 1 V, which is the vaccination. The 3 W's being wear your mask, watch your distance, wash your hands. These things are really something that have proved to work. And gathering in big groups, it's just letting down our guard. We're not yet there, so I think being mindful of that and adhering to these as much as possible, we'll get there with the vaccination efforts that are currently ongoing in our county. You're muted, Justin.
Thank you. Sorry. Yes, I was just saying that, yes, there is light and we will certainly get there. I can feel it. Okay. Claire Hart says, besides performers and audiences, a theater production will have a lot of people backstage, hair and makeup, costumers, set movers, many others often are backstage and in close contact. If IDPH does not have specific guidelines for theater, may we contact you for maybe ideas on how to facilitate and mitigate?
Well, I think you can. We've all got ideas and suggestions. Just to make it as safe as you can humanly make it, and still function. I think when Vidya was talking about the pod or the close group, you practicing together and working together, you're kind of like a little family, and the family unit kind of stays together, and you know where your risks are. Wearing masks continually when you can, and being really careful with that when when you can wear them, keeps you safe for a long time. But you will have people, costumes and makeup and everything else that's involved. And I think one thing is just kind of remembering your distance and keeping that 6 feet or so around you if at all possible. I think after this year, we're all kind of trained a little bit. I used to be a big hugger. I can't do that anymore. And you can't shake hands. And it's the things that we've kind of learned. If we use that a little bit, and we've got some memory and knowledge now, so if we use those, that should help a lot.
Yep. Such a great question, because oftentimes there are a lot of people behind the scenes, maybe even more people behind the scenes than there are on stage. So it's certainly a good question, valid question. Let's get to some, I'm trying to go in order here, and I saw that there were a couple hands raised, so I'm going to kind of go back and forth. Let's jump in. I see Dennis Thread has his hand raised. And so I just clicked on Dennis. Let's bring him in. Dennis, are you there?
Yes, I am. Can you hear me?
Yes, I can hear you. Thanks for joining us.
Good evening, and thank you for doing this so much. In terms of production, the industries, both the theater industry and the film and television industry, have worked together and have developed a series of guidelines in terms of how to handle productions and rehearsal. And I made a note of it in the chat. Actors Equity Association has an excellent document they call their 4 principles for testing and rehearsal. They're very straightforward, a lot like the pod approach that was mentioned. And then the film industry, Directors Guild of America, IATSE, and SAG-AFTRA, et cetera, has put together a Safe Way Forward document. You can find these on their websites. And that is really useful for this situation and for us here locally, because a lot of us are doing Zoom productions. The film industry guidelines would be useful in certain circumstances as you develop these hybrid productions.
Thank you.
Put that out there, take a look at them. There have been, they've been have been up and in use them. They've been using them for months at this point. There's lots of data on that and anecdotes that you can find online.
Thank you for that reference.
Yes.
Justin, you're muted again.
Oh my gosh, I'm sorry. You think I'm used to this by now? Here we go. I'm muted. Let's go right to Reggie. Hopefully he joins us.
I guess I'll pop back on camera for a little bit. First off, thank you everyone for joining us and making this such a success. I'm really happy to see that there's interest in getting us as close to a normalcy as we can get to, but also doing so safely. And my question, I don't really have a question, but more so speaking to the situation at hand. When we recorded Spirit of Lincoln back last year, we had to obviously go under certain mitigations. There were smaller rehearsals. And even listening to the suggestions that have been proposed by both Gail and Vidya, thank you both so much. I've noticed that there is much more concern of keeping smaller groups, not just with the maintenance in rehearsals, but also overall. So I guess what I'm trying to figure out is is there a way to, would you recommend staggering rehearsals in a way? We did try that method and it worked fairly well for Spirit of Lincoln. We kept a certain amount of rehearsals up until a certain number in rehearsals up until we got to Tech Week and Performance Week when we recorded the show. Would you recommend, would you say that along with the focus on wearing masks and along with the focus on keeping things clean and spaced out, that we should really put an emphasis on having smaller groups.
Gail, do you want me to comment on that first?
Sure.
Thanks. So there are two things I would say that, with most of the situations, masking distance and watching your distance, number one thing, that really, really works. Disinfection definitely works. Third, keeping the group sizes small is also a great recommendation, and that works too. And fourth, cleaning surfaces, still recommended. I think all those four are great ideas to incorporate. In phase 4, you would see a lot of the recommendations, the school recommendations, and most of the other group recommendations that we are seeing have all these incorporated. One other thing that I would like to add is ventilation. So if there is at all a possibility to open windows or have good air exchanges, that's another thing that really helps with COVID.
Yeah, I was thinking the same. Yeah, I was thinking the same thing. Is in the back rooms where you might have, or behind the scenes, a lot of people in movement. The air movement is good, and even moving some fans, that won't impact the performance, may be a very good idea too. I think the other thing that we tend to forget about is, and when you're getting ready for a performance or working at all, that if anybody is sick, you need to stay home. I mean, I think that people might think that they just have a little sniffle, don't want to miss something, but it's important for the performers and the audience, but mostly the performers. You guys stay together in your groups and practice and rehearse in the same pod as a safety net. And then if somebody has the slightest concern about being ill, they need to not be at the exposing anybody else potentially, or catching something themselves. Now I'm trying to sound like the doctor. Dr.
No, it is all good. Thank you so much, Gail. Let's go to, Let's go back to the chat. I saw there were a couple more questions. Let's see here. Okay, Amanda N says, do you feel rapid testing could play a part in safe rehearsals for the performers when positivity rates are low with no known exposure? So just the significance of rapid testing right now.
Amanda, you asked a question that's really close to my heart, so I'm probably going to give you a long answer to that. So what is rapid testing? Just to kind of talk about that. There are tests that are point of care, so you have the answer available, whether or not somebody is infected with COVID or not. In about 15 minutes or 20 minutes, the test is done and you have the answers. So we have some of the rapid tests available here through the health department. Gail has really very generously distributed those to multiple venues in the community where there is a need for the rapid test. So it's just a card test. It's a lot like those strep throat tests, the rapid strep throat tests. You just put the swab in a little circle, add a little bit of a reagent, and it tells you positive or negative. So it's pretty simple to do. But for being able to do that, there are a few criteria. You have to be able to enter all that information and have it in a system called REDCap through the health department. So the data entry and maintaining this data meticulously is absolutely important. And then the second thing is anybody that does that has to have a status called a CLIA, the lab waiver status. So applying for that can be pretty painful too. So, a lot of times these other venues that we've used those in, we've had people that are trained to do these tests that help out at least with the data entry part, and then also, interpreting these tests. These tests, when the community transmission is very high, you can have false negatives. So somebody's coming in with symptoms, you get a negative test, it could be a false negative, you worry about that. And in those situations, you want a confirmatory test, which is the regular good old swab my brain test. So that's the PCR. So, those tests are needed for confirmation. When the community transmission is low, I'm glad you said that. When the community transmission is low, if somebody gets a negative test, it's more of a chance that the negative test is a true negative. So there may be value. There's definitely some value in looking at those tests. In higher education, college students, if you have kids that are attending colleges, you know that they're also doing something called a saliva-based test, where they spit into a tube and the test results are available there and then too. And that actually recently got FDA approval for an emergency use authorization. So that's available here too. UIS uses that quite a bit. I don't know. There's definitely value in these rapid tests, but how we use them and how we interpret them can be pretty challenging. So, we need to make sure that whoever's using them is trained adequately, knows how to interpret this, so we can be safe when we're using these tests.
What a sigh of relief, because those spit tests, I was concerned about it. I wasn't sure, but it's good to know that it's all approved. Thank you, Dr. Sundarashan, for that. All right, let's go to Vanessa. She says, I've noticed that those getting vaccinated are gathering in groups and have said that it's okay because I'm vaccinated. So is this okay in your eyes, or is this a problematic thing that's going on in our community?
Gail, you're muted.
I'm telling you to go. Go.
All right. So vaccination will help with prevention, but it doesn't really completely eliminate transmission. You can still transmit COVID. And with the strains, we're also worried about vaccine breakthroughs. So, at this time, till we have more information, until we see how the vaccine's actually performing, of course, that graph looks great, but at an individual level, we still need to do what we need to do in terms of masking, in terms of watching our distance, and until a sizable number of our community members are vaccinated, till we have 70% is what we really want to get, at least a minimum of 70%. More is definitely better. But yes, we're not there yet to be able to congregate without masks just because we are vaccinated. We still need to make sure that we are not actually transmitting it to anyone else. They are studying now to see how much of difference it makes in transmission if somebody's asymptomatic, if somebody is vaccinated. Does the virus in their nasopharynx actually reduce? Yeah, there's evidence of that. With somebody being asymptomatic, the chances of transmission are lower, but it's still there. So you don't want to have that chance at all. Still recommend wearing masks and watching your distance despite being fully vaccinated.
Okay. So do not congregate still. I know we're all itching to be together, but we can't do it yet. I'm going to bring in Gus again.
Quick question. Not all rooms are created equal. And when I say that, I mean at the Hoagland, we've got a 450 seat theater and we've got a room that can fit about 100. So does the rule of 50 count in those smaller spaces, or do we have to come up with some kind of ratio in that situation? In a smaller room, do we cut it down to 25 people?
It's actually, the occupancy is either 50% or 50, whichever is less. So that if you have a room, so it's the lesser number of those two.
So even in a small room where you're tightly packed with 50, that's as okay as in a big room with 450 seats and having just 50 people in there. That's what's confusing to me.
Well, yeah, and that does make sense. So do you have an occupancy on a smaller room? Is there an occupancy load that's established?
Well, that would be about 100.
Oh,
compared to 450.
Yeah, that doesn't make much sense, does it?
Yeah.
I mean, overly cautious. I mean, you'd want to, families or people that travel to the performance together could sit next to one another, but it would be better to space everyone out yeah, and lose the, spacing, at least every other seat, or shooting for the 6 foot, whether that's 2 seats or a seat apart. Yeah, that's a good point.
Okay, thank you very much. Any idea of when it will be safe for us to take that first big step forward? I know it won't be normal, but best guess?
Vidya, do you have any idea?
No, no, we're just from the county level, we're almost always looking for recommendations from IDPH. We are very, very particular that we align with what IDPH says. So we're really looking forward to any guidance that comes from IDPH, so we can follow those locally as well.
Well, and I think right now what's going to motivate the state is a lot from the schools, because they have a lot of push for sports and for activities to keep kids in school and interested, and they can't do that. So once they kind of change gradually with the schools and sports and plays and band and music, it'll probably trickle down.
Okay. All right, thank you for that. Vanessa had her hand raised. I saw Meredith had her hand raised. I don't see it anymore, but Meredith is awesome because she works for the Morgan County Health Department, our neighbors in Morgan County. So Meredith, if you still have a question or if you're still there, you can chime in too. But let's go to Vanessa. We're going live, Vanessa.
All right. So I don't know if this is so much of a question, but maybe something that you could speak on. So it seems like because guidelines aren't completely clear in specific scenarios, like I think Claire mentioned in the chat, being in the backstage area or being in dressing rooms, or with some of these specifics like Gus mentioned, how many should be on stage, how many should be in the audience. Is it fair to say that just because there are not specific guidelines, or just because you can do all 50 in a room, that we might need to use our best judgment and not just jump into it just because we're legally allowed to? What could you speak on that?
I think it's a good idea to go cautiously and with what you feel is the right thing to do. There's not rules for everything, but I think the people coming to the performances and watching you take their safety and the actors' safety in mind, I think that would, and yet you're gradually going to a slower start, would give everybody some comfort to know that you've cared, and then if something happens, you've done everything you could to prevent a spread or prevent someone from becoming ill. I mean, it's hopefully at some point this will become like the flu, where people don't intentionally give each other the flu. It happens, and at some point down the road, hopefully we'll be there. But just because there's not rules, that's why we gather the information from other places to try to make your best informed judgment. Vidya?
Yeah, I completely agree. I think we really need to watch out for each other's safety first. So, the masking and 6 feet distance for sure. I mean, like Reggie asked earlier, masking, 6 feet distance, those things we know definitely work. Wiping down surfaces frequently, that is also very important. And then, again, not having too many people close together. So being mindful of all those things definitely will help us. Even in the absence of guidelines, we need to be mindful of that.
Okay. Let's see. Tammy said that there were some questions that were submitted to us as a pre-registration. Let me see. Tammy submitted them. Oh yeah. Yes. So I actually do have the questions here.
Oh.
So, yes, I do. And a lot of them actually were answered, but a couple of them really stuck out to me, and it dealt with children. Someone, Jenny wrote, is it safe to be singing? Also, is it healthy for children to sing for an extended period of time with masks on? Is there a type of mask that you would recommend for singers? Do you recommend time limits for rehearsals and or performances? I know for Songs of a New World we did last summer while we were all in quarantine, or many of us were in quarantine, but we were able to do it, and we ordered these masks, which is really nice because we were able to sing and open our mouths not comfortable, not the most comfortable, but it was just something that we used for rehearsal, which was nice. But yeah, any recommendations? And also just kind of moving towards children. A lot of people are concerned about having their children be in rehearsals or be in tight spaces, especially since, you know, some children like to be close and like to hug. So can you give us some insight on that?
Yeah, do you want me to start? All right, I want to make a few points there. You know, our schools have really done very well. So we can, you know, take a lot of pointers from them in terms of, you know, in-school transmission has really not been much because of good compliance with mask wearing, and then also good compliance with watching distances. So these things really do work, and we've really kept our in-school transmission to a minimum because of that. What really is the problem is when people start getting together socially outside, congregate after school, or, you know, after school activities, things like that. That's when we've seen a lot of the cases there. So if we follow that, we have these strict guidelines in place, and CDC kind of walks through this as well. Children understand. So if you talk to them, you explain to them, they do understand. And, you know, even when you're having these outings as families, just kind of talking to them about this, they definitely do understand and practice that. That's one. Then coming to your question about singing and with special masks, and is it really bad to wear masks for a very long time? Mask breaks are good. You know, when for wearing a mask for a long time, if you're outdoors, you can take the mask off for some time. For instance, recess, when children have recess, or if they're eating, they're all, you know, spaced apart and they're still in that pod, they can take it off for some time and then put it back on. So mask breaks are not bad, but you have to do those in a very safe way as well. With any special type of mask, Justin, I really like the mask that you showed. I saw Broadway was selling that. I'm not sure. It's so it really looked nice. The only thing I worry about with masking is it has to fit very well. So make sure, I saw that when you order those, you have to have specific, you know, the lengths and all that. You have to really talk about what your ear to ear distances and chin to nose and all that. If it fits well, that's fine. Otherwise, you know, it loses its purpose if it's sliding down or somewhere on the chin, just covering the nose, on your neck, then it doesn't serve the purpose. So I would just warn about that. It has to fit well, and it should be double layered. So anything that's double layered, CDC is okay with.
Good to know. Good to know. Thank you for that. Yeah, masks are like a thing, you know, and you were mentioning that in your slideshow, shields versus no shields, and it gets very complicated. Thank you. Go ahead, Gail.
Vidya, the question that I was going to listen for your answer to is, you know, the children and having the mask on too long or singing, is that harmful to them?
No, there's really no data to suggest that. That's why the mask breaks when they're outside for recess or things like that. It's okay, but that has to be done in a very safe way. But there's really no harm from keeping the mask on for a long time.
Thank you.
Okay. And speaking of children, also, someone asked, are we aware of any vaccines that are maybe being reviewed for children? And maybe what are some infection rates, if there's any data about that among children? Is there maybe an upward or downward trend?
Great questions. So with regards to the vaccines, so we have 3 available now in the United States, which have an emergency use authorization. They're not approved, but they have the emergency use authorization. So the 2 mRNA ones, Moderna and Pfizer, are doing actually a step down study. So Pfizer is recommended for anybody that's 16 years and older. Moderna, anybody that's 18 and older. But both of them are now studying 12 to 15 age groups as well. So they are studying that population. In fact, a lot of the people here were even wanting wanting to enroll their teenage children for that study. Nothing here in our area, but there are lots of children being studied for those age groups, and they are planning to go backwards in the step down studies down to about 6 months of age for children. We are hoping to have some data from the 12 to 15 age groups by summer. But we don't know. The approval process, etc., takes time. So by summer, we'll at least have some good data in how it's performing for children. And it looks like it's going to do really well in that age group as well. And then there was another question about prevalence in children. With COVID, the prevalence in children is definitely much lower. There's some studies from China that says up to 13 to 15% of people with COVID were children. In in the United States, it's about 5% from some studies. So it's definitely lower as compared to adults. What is different with children getting COVID? They don't get very sick. So they may even be asymptomatic, but they may be carrying a lot of virus. They are not super spreaders like adults. They don't get too many people infected with like one person that may be carrying the virus. Adults can be super spreaders, less likely to happen in children, but they can still transmit the disease. They just don't get very sick. I do want to mention there are some kids that can have significant severe complications if they have underlying health conditions. Children are more prone to having severe disease. And there's one condition which we really look for and are worried about. It's called multi-system inflammatory syndrome of children, MIS-C, which can be very dangerous in children. So that's what we kind of worry about with children and COVID.
Okay, perfect. Thank you. Cynthia just put something into. First of all, thank you, Meredith. She put some really great resources in the chat as well about attendance in audiences, 50% in theater venues. So check that out. Thank you, Meredith, for that. Cynthia says, thoughts on when Illinois or Sangamon County will move to phase 1C or phase 2 for vaccinations. A lot of people waiting for vaccinations. It's a thing. Everybody needs it. Everybody wants it. And so what are some thoughts about the future, the foreseeable future? I know there's good news in store, especially as more vaccines are out there.
Yeah, I think once more vaccines are out there and they seem to be coming, and if they start coming in the volume that we're seeing, then, we would probably move on to 1C. Everybody wants to know when 1C. We just started 1B on the 25th, and everybody's anxious with that. The state will kind of decide that for us and tell us when based on the vaccine that's available. One of the concerns the health departments all had, because lots of places aren't getting very much vaccine, is that they opened it up to the the people with health conditions between 64 and 18, and there's not enough vaccine to do it for them. We hadn't really finished the people 65 and older. So, but it's going through. So I don't know if they're going to hurry this along or if we're going to get enough time and vaccine to vaccinate the 1B plus group next. I had thought that maybe by the end of March. I think that was a little optimistic, but if vaccine keeps coming, we could move to 1C before too long. I think we were talking fall before, but things just feel like it's going to go better than that right now for me.
Yeah, Gail, actually this morning, I think Chicago was saying they expect to move to 1C by the end of this month.
Wow. Okay.
Yeah. Well, I don't know if we are continuing to vaccinate at our rate.
Yeah, it's true.
Well, we'll see. Yeah.
Yes, that's good.
Awesome. Yep. Can't wait. All right. Another question. It has something to do with woodwind band instruments like the clarinet, the trumpet, the saxophone. What are some of the regulations on maybe playing those? It obviously requires a lot of breath, and which could lead to droplets, correct me if I'm wrong, but of course it can lead to the spread of a virus. And also, is it safe to share props, microphones, and sets and chairs if they're wiped down after each use?
Go ahead, Avidia. You're the wind instrument expert here. You've got family experience, I should say.
Yeah.
Yeah. Well, I was looking up the guidelines, and it was there on the slides. Those 3 guidelines, the music and band guidelines, they were really well written, very, very well written by, I think, a Dr. Bowser from Chicago, very well written. And it was, of course, the IDPH team, and they looked at it and said that it's not changed. It was updated again in sometime mid-February without any changes. So the last guideline said that you want to try to avoid sharing any instruments as much as possible. If you're using a piano or something that has to be shared, you need to make sure that it's wiped down very, very well. But try as much as possible not to share any instruments. Props, for dance and other productions, they say try not to use any props. For band, if you can avoid sharing, it's best. So as of now, that still stands.
Okay. And as far as, this is something that us theater people do a lot. We share microphones. And did you already say that? I'm sorry. Did you mention that already?
I did not. I'm going to let Gail talk about it.
Okay. Yeah, Gail.
Gail has stories about that.
Yes, I have stories. One of the days early on when we were trying to decide, we meet with Dr. Sundaration and Dr. Graham and several doctors every morning. We've just gone down to 4 instead of 5 days a week for the last year. But one of the things I kind of asked the doctors one morning was, okay, what's the most dangerous thing someone could do to, spread this virus? And within a second, the answer was karaoke. And that's how we killed karaoke in Springfield for a while. So we, because they're talking about, the environment that you're in, they're generally smaller quarters, the volume with which you want to push out the music and to be the rock star, it just seemed quite a bit too dangerous for us. So, and it is the microphone, and it is the amount of effort and wind that comes from your toes all the way out to try to share, probably a lot the same way that you have to with singing and sharing and being louder. Is that the story, Vidya? I think so. So we have a few people that, well, actually the state has adopted and said karaoke's out too. So I don't know if we were trendsetters, but we're not. I know I have to promise Jim Leach so he can make the announcement whenever, because he loves karaoke. We've learned that when we can announce that people can go back to that, there'll be a lot of happy people. But right now that seems to have been the most dangerous thing that we thought people could do at that time.
Oh my goodness. Karaoke is dead thanks to Gail O'Neal.
No. Temporarily, hopefully.
Temporarily. Let's bring in Gus. Gus had a question. His hand is raised. Let's get him.
Yeah, I wanted to ask about choral singing. We've talked about individuals singing and so forth. What about groups of 4, 5, 6, 20 getting together in a group and singing loud and proud? What do you have to say about that?
I don't know, Vidya, you want to do that one?
Well, the biggest thing is to stay masked as much as possible. Well, you should stay masked. And then if you can keep that distance 6 feet as much as possible. There are some recommendations, or it's not really a recommendation, but some data from American Academy of Pediatrics for Children to shorten that distance a little bit. And it's not always possible to keep that 6 feet in smaller spaces. So never less than 3 feet, never less than 3 feet. But again, this is not a formal recommendation. This is just data from American Academy of Pediatrics, and then also the 6 feet we want to keep as much as possible between the participants.
Is that good, Wes? Okay, great. Let's see. Oh, this is a good one. I really like this question. Is it still a best practice to take temperatures of people attending your events? How reliable is temperature screening? I've used a couple of those temperature guns, and literally it's numbers that don't even make sense. It'll be like 40 degrees or like, just numbers that I feel like aren't accurate. So let's talk about temperatures and properly taking temperatures. And is it really necessary? Is it really best practice to make that happen if you are holding some type of an event or of a production of some sort?
Go ahead.
Yeah.
Yeah, go ahead.
Well, you want to start? I can chime in.
Okay. Well, I think that even with the schools, they've decided that it isn't worth the time with trying to check temperatures of all the children coming in, and kind of left that for the parents to determine if their child is healthy enough to come to school, with the bottleneck of that. And I too have seen where we're still temperature checking too, and everybody's seems to be the same some days, and it's 94, and people aren't 94. So I
Yeah.
think the tools are something that you have to make sure you know how to calibrate and watch. I'll let the doctor answer this one. I don't know how good it is. It does start your day with remembering that you're being cautious right away. And I don't know if we've ever caught anybody that actually showed a fever or not.
Yeah, it's still a recommendation to check temperatures at the entrance, like Gail was saying, and as Justin, you were mentioning, those infrared thermometers are really, really bad.
Yeah.
So you take your temperature, one spot on your forehead and another spot on your forehead, it'll show you a different temperature. But something is better than nothing. I think if somebody has a burning temperature of 101, that's really, from an infectious diseases standpoint, what constitutes a fever. You should be able to pick that up. So I think something's better than nothing. In a lot of places, like Gail was mentioning, you have apps or some kind of a pre-screening, which should be done, which definitely should be done. It's a good practice to just go over every day when you're leaving home. Is it safe? Am I okay to go out and work or do my activities the way I'm supposed to? Checking your temperature at home, if you're not required to, would be something that's definitely useful. We in healthcare, we have an app. So you're supposed to self-report your temperature, and it goes through all those questions. Do you have anybody that's had COVID in the last 14 days that you're exposed to? Doesn't make sense. A lot of us see patients with COVID, but the real intent is to identify anybody with a close contact who could potentially be exposed and needs quarantine. So with that in mind, when you're answering these questions at home or for an app or any other situation, just try to be as honest as you can and mindful.
Yep. And honesty, none of us want to be sick, but that is a very good point. It is okay to be honest, and it's not an embarrassing thing. So certainly something to keep in mind. Thank you, Doc, for that. Another question: we all love food, right? And we all eat during rehearsals, and most times they're indoors. We share snacks, we share birthday cake, we drink coffee. So what are some of the guidance on maybe this virus maybe being transferred through food? I'll see people in maybe the food court at the mall, and I'm like, oh, their masks are off, or maybe even in Starbucks, and I get worried, or in Chipotle, people are not wearing their masks. So what are some of the stats or maybe the data to indicate like maybe we can eat safely, but what are some of the things that we can do to just ensure that we are safe in close quarters when we're eating?
I think this resource has been posted many times in the chat. The Restored Illinois that talks about theater safety, they talk about food there too. Grab and go is a good idea, and they talk about restrictions of how big the courtyard or the area should be, etc. As much as possible, when we are unmasked to eat, you want to try to be, if there are people working together in that group, the pod, they're probably okay being seated on one table. But even in cafeterias and things like that for schools, the requirement is that you want to space the tables about 6 feet apart. So as much as possible, when you're unmasked, you want to maintain that distance safety. But sharing food is absolute no. I want to share some of my personal experience there. I have not shared a bite or shared any food with my children for over a year, even close family. So So I think sharing food or sharing anything that you can take a piece of, and if it's a buffet or something like that, they had recommended that for the Thanksgiving guidelines, and what kind of food is safe, how is it safe. Anything that you can take a bite of and you can touch, a sandwich, cookies, and things like that, you should try to avoid as much as possible.
Okay.
And that being said, I miss PAVE. The last day of PAVE is just such a food fest. I really miss that. So,
Yes.
but we have to do what we have to do to stay safe.
Okay. Great information. And of course, we all want to eat and congregate together, but it's not a good idea right now. Okay. Anybody else have any questions? I don't want to take up too much of you guys' time, but there are so many great resources that Meredith also has been sharing in the chat as well. There's so many great things out there and great things to read. Dennis, maybe a final question? Okay, here we go.
Yes. Back to, this is a slightly different venue question. Any ideas in terms of how to handle a situation where you're working in a non-traditional space outdoors, a space that's not designed as a theater, street theater, that kind of thing? Any idea about how to handle that as the weather gets warmer? Asking for a friend.
Again, when you have formal guidelines, that of course trumps whatever we're saying. The speculation, again, I would, if anybody were to ask me that question, I would extrapolate from what's available for the sports guidelines. You really want to make sure that there is at least 12 feet of distance between the performers and the spectators. 30 feet. If it's an outdoor and you can maintain that 30 feet, that's even better. People that are performing, again, wear your masks. If you can be physically distanced, good. But if they cannot, then make sure that they are a pod that's been working together.
Yeah, the 3 W's. I'll always remember it now. Thank you so much. All right, well, we're going to wrap it up, everybody. Thank you so much. And don't forget to click in the link on the chat. There is a survey there that you can take. And again, we want to thank you so much, Gail and Dr. Sundararajan as well, for being here today. These women are doing an amazing thing right now, and I just give them so much credit. We should all give them a lot of credit for educating the community, for undertaking mass vaccination sites, and COVID-19 testing, which has been happening for a year now. So amazing women doing amazing work. And I have the chills right now because none of us asked for this. And certainly none of Gail or Dr. Sundararajan didn't ask for any of this, but they are dedicating their lives to this. So we really, really appreciate you guys for being here today. So yeah, fill out that survey. And there's many, many more things coming up through the month of March as far as the webinar series, the masterclass series. So check that out. STC is doing some amazing things to keep our community educated and in tune with the arts community. So we love you guys so much. And I can't wait to be back in theater again with everybody and to sing again. So I'm not cooped up in the house. So we thank you guys. Have a great night. Get some sleep. And until next time.